Hi, good evening, everyone. Thank you for joining us for this special CyAsia webinar on the trend in IPL technology for Asian skin, current practice, and the future directions. And first, I would like to express my sincere appreciation to FormaTK Israel for their generous support in making this session possible. My name is Dr. Patrick Huang, president of the CyAsia and a dermatologist based in Taiwan. And I have the pleasure of today's session, co-chairing today's session together with my friend, Dr. Peter Chang, the president-elect of CyAsia, and also uh, Dr. Chang Kun Oh, immediate past president of Korean Dermatologic uh, Association of Korean Dermatologists. And it's truly my honor to be working alongside with two esteemed colleagues. Well, Chang Kun, would you like to make a welcome remark?
Hey, I'm Changan Oh from Korea. Uh, Good to see you all, and I expect your good lecture tonight. Thank you so much.
Okay, thank you, Chang Kun. And together, three of us will guiding you through the exciting, insightful session, exploring the evolving role of IPL technology in Asian skincare, particularly in the treatment of acne, rosacea, pigmentation, and how we can improve both efficacy and safety in clinical practice. And I would like to introduce the three outstanding speakers this evening. Dr. Nadav Pam, Clinical Director of Forma-TK Systems in Israel. And we'll begin with a presentation title as IPL Monotherapy for Acne Vulgaris and Rosacea in Asian Skin. And the next, we'll hear from Dr. Fountain Tong, a dermatologist from Vietnam, who will speak on clinical management of pigmentary disorder in Asian skin using IPL. And finally, we'll welcome Dr. Ping Chen, a plastic surgeon from China, who will present clinical insight into IPL and factors affecting efficacy, adverse event, and practical solution. So let's welcome the first speakers, Dr. Nadav Pam, please.
Thank you very much. I will now share my presentation. Can you all see my slide? Great. So first of all, it's a great honor to be here today and to be able to again work with CyAsia, with all the co-hosts here, and let's dive directly into today's event. So I'm going to speak about the monotherapy about acne and rosacea in Asian skin with evidence-based approach. So my name is Dr. Nadav Pam. I'm the clinical director of FormaTK. We are based in Israel and we exist in more than 40 countries. And I'm honored to share today my experience with this system. So the session's objective is to understand the rationale for IPL monotherapy in Asian skin, explore safety and efficacy, and review clinical data and patient selection strategies. So we know that in Asian skin we have higher melanin content compared to skin type 1 till 3. We have a risk for hypopigmentation or melasma exacerbation, cultural concerns, and in some areas where there is more moisture, we can also get more acne from the back. Now, not every IPL system since the 90s has been built the same way. Some don't have even approval of FDA or CE. They don't have reliable safety feature. They don't have accurate energy delivery. What is on the screen is not what comes out from the applicator. Each one has their own protocols, time interval, and there is no gold standard. So it's easy to have, if you're not buying a proper device and have proper training, to have side effects. So today I'm going to share my experience on how to avoid those. So in order to be successful in treating Asian skin in general, all the patients, you must have informed consent, comprehensive medical history, contraindication assessment, always take photos of the patient before, always perform patch tests, especially in skin type 4 till 6. You have to wait 24 to 48 hours before you treat the entire area. A lot of people are skipping this. I advise on using a melanin meter that can detect superficial and deep pigmentation. Therefore, superficial is what we can see on the skin right now, and the deep version is what is not visible yet by naked eye. Once you put this on the skin, you will get all the energy parameters from our systems. And in addition, you use conductive gel like Parker gel, which is transparent to protect the skin. And please provide ocular protection for both user and patient. If you follow all of these steps, you are guaranteed to have successful treatment. That means safety for the patient and clinical results. If you by-step one of those things, you are prone to increase the risk to have side effects. In dermatology in 1975, Dr. Fitzpatrick and American dermatologists have established what we know as a gold standard that divide all of humanity into 6 skin types. However, Asian skin types 4 till 6 are underrepresented, to my personal opinion, in this gold standard. But still, we are using this compared to other obsolete or still not other new ones that will replace this one. But with the melanin meter, what we get is we have a number between 0 to 100 from the area that we are going to treat. Each area we are going to test it again. We'll get a number, we'll feed this to the screen, and the device will give you the preset of pulse width, rate, energy. This will create high safety protocol. That means you are not guessing anymore, because there is a lot of different tones and shade between skin type 4 to 5, 5 to 6. Also, you have pigmentation in hair follicles, and a lot of unexperienced users will make a mistake by choosing the wrong energy setup. This is the key thing to ensure safety in our protocols. Use melanin meter, each area measure it, and get the energy that you need. So what about acne vulgaris in Asian? So globally, acne vulgaris is the 8th most common skin disease. 85% of adolescents will have at least one time acne, and 30% of them will have acne scars. In Asia, it depends on the country and also the climate. In East Asia, China, Japan, Korea, it's between 15 to 20% of general population. In South Asia, India, Pakistan, Bangladesh, it's 72 to 95. In Southeast Asia, Vietnam, Thailand, Philippines, it can go between 50 to 85% due to humidity. In general, acne vulgaris treatment has high return of investment because there is a lot of demand for it, and there is a lot of research about it as a disease that has a lot of burden, also social and psychological effect on the patients. So why to use IPL and why to use 430? IPL targets copoporphyrin 3. It's a chromophore that only the P or C acne, depends on the nomenclature, contains, not the human cells. So you are placing the applicator with gel directly on the inflamed lesion and shoot one pulse. So one pulse means you eliminate one inflammatory lesion. In addition to that, what the heat does in the accumulated by the P acne, it converted to radical oxygen species and destroy the P acne from the inside. Therefore, the bacteria will never have resistance. In addition, you have a dual mechanism that you also have thermal effect, and this thermal effect reduces inflammation. So by choosing IPL 430 in particular, it's a non-invasive method. You don't have consumables. There is no downtime for the patient. It doesn't require any blood monitoring, and there is rapid onset. That means from the moment of treatment for the time of clinical results, it's between 72 hours to 1 week. In addition, you can treat face, chest, and back in the same session under 15 minutes. Yes, you are not going to stop new acne to appear, so you have to do it once a week, but it's the fastest ongoing thing, and you don't need patient compliance. They just need to arrive. So if they are under 18, the patient sign informed consent, they come from school, do the treatment, go back. There are physical activities, they can do whatever they want. So what the patient see is that he has acne. In the next week, the acne that you treated is gone. What other alternatives do we have? 70% of acne treatment worldwide is by oral drugs and topical drugs prescribed by the doctor. Why? Most of the time, it's subsidized by the HMOs locally. That means the doctor will give a prescription based on the patient's compliance of taking the daily pill and also doing blood monitoring. He will continue to give the prescription. But in vitamin A derivative, isotretinoin, you need to wait 16 to 24 weeks before you have clearance. Again, this is first-line treatment. That's what is in the nomenclature in the books. Topical also depends on the patient's compliance on putting it at home, because at home it's not a lab and it's very hard to put on the back, and you know the tubes are getting smaller all the time. But with these things, you have limitations. You need user compliance. Low light therapy is very popular, but you need 3 times per week, about 3 months treatment, and each body area it requires 30 minutes. If you don't have the more sophisticated version, you can only put it on the face and not on the chest and back. But again, if you want face, chest, and back at this one session, it's about 1.5 hours, 3 times a week for 3 months. It's very hard for the patient to comply with that, and it's usually indicated for mild acne. Laser, there is the new acne of 726, which is FDA approved. Unfortunately, it's extremely expensive. Not only that it is expensive, each treatment is expensive. So the chance that the patient will have access to a doctor who actually has it is very low. So therefore, I don't know from return of investment how easy it is to get access to that, but to pay thousands of dollars for a treatment and hundreds of dollars for the device, I think it's not cost effective. With IPL, the system itself is much cheaper. On average, you have 100,000 pulses. That means you can eradicate 100,000 acne lesions. And it works in all skin types. It's FDA cleared and also CE. So it's very safe and effective. You target only the P acne because of the copper porphyrin free, and you also have a thermal stimulation effect that reduces the inflammation. This is an article that was published in 2018 using our device on 100 female patients in India with skin type 4-6 with acne levels of grade 3 and 4, and they had 80% clinical improvement with only 7 joules, which is very, very low, but it was also effective and safe in these dark skin types. And this is also a problem by other technologies. Can they actually treat such severe form in such dark skin with such effectiveness? And here you can see, and it's published in PubMed. I have here my colleague with Dr. Nam, he's a dermatologist from Vietnam. He used our system with our IPL on Vietnamese patient with skin type 4. Here you can see results after 6 treatments once a week. Again, another patient and another patient. So I'm showing you basically that it's safe and effective, and I hope that in the future, in the nomenclature of the dermatology residents and beyond, that IPL will not just be a 3rd line, but maybe will be 1st line or 2nd line. What about rosacea? We know that rosacea is a chronic multifactorial skin disease. It has genetic, immunological, outside triggering factors like sun. Also alcohol and stress can help with that. So what do I tell my patient? I'm not curing you, but I'm putting the disease in the background, and it's good enough for the patient. Traditionally, classical European ways of classification of rosacea is the type 1 erythrotelangiectatic, papulopustular, phimosis, and ocular. Unfortunately, you don't see here any Asian types. Why? Because it was underreported. According to numerous publications, underdiagnosis of rosacea in Asian population and individual with skin color showed numbers that doesn't correlate with reality. So in the literature, it tells that there is less rosacea, but actually there is a lot more rosacea. It was underdiagnosed, and it took longer time to diagnose because of differential diagnosis of how the disease looks like on Asian skin and skin of color, and also who wrote the books in dermatology at the beginning. So Westerners, and they took their own approach for that, and I think that in the future books, the numbers should be corrected completely, as long as there will be more publication and the data will be revealed that also Asian skin has a lot more rosacea than previously thought. These are my suggested proposed distinctive features of Asian versus European rosacea. The common subtype is more papulopustular. Often they don't have flashing like in European, and there is less connection to the sebaceous hyperplasia, and also there is diagnostic confusion. And also psychological distress. That means that the patient doesn't know who to address even in Asian cultures and how to solve it for him. So I think that once there will be a higher awareness for that, then they will know which treatment they can have, and I'm going to show you why IPL works for this as well. In the last, let's say from 2028, like last 20 years until now, a lot of new articles were published around the world of non-pharmacological treatments for rosacea. And why? Those who have given drugs know that if we have oral or topical drugs, maybe at the beginning it works and later it stops, and you know that the disease is chronic. Without treatment, it will just get worse, and it's for years. And already in 2017, the Swiss task force has done meta-analysis and have shown that IPL has 3 pluses for type 1 rosacea. But still, the books haven't been changed in the educational system for dermatologists and family doctors that IPL can be the 1st line treatment. And I know that I have prescribed a lot of drugs in my past, and at the beginning maybe it helps, at the end it doesn't. But to take a drug for 30 years increase potential for side effects, and maybe you switch another drug and the patient start losing trust in you. So how does it work? I don't know what is the chicken and the egg story. If you have more rosacea, you have more Demodex, or if you have more Demodex, you have rosacea. Whatever you might believe, the thing is this: Demodex is heat and light sensitive, so if you put the heat of the IPL, you will reduce the number. If you reduce the number of Demodex, you reduce the number of the inflammatory cascade, and you will have less signal of VEGF factor, vasoendothelial growth factor, just like the trigger from the sun with the UVB. If you have less of that, you will have less blood vessels on the skin. We know that in the blood vessel endothelial wall, you have a chromophore called oxyhemoglobin. So when you do the 590 flash with the IPL, you target directly the blood vessel that exists and also decrease the number of Demodex. So you destroy this vicious cycle for a while. That means in about 2 months of treatment, you can bring a patient with rosacea to the fact that he doesn't have any visible rosacea on the skin. And this is good enough for the patient without need of any drugs. So what are the advantages of using specifically 590 to treat rosacea in Asian skin? 590 is more safe for darker skin types. It's more, it targets more oxyhemoglobin and less of melanin. It will also reduce the number of Demodex, and it's safe. The thing is, a lot of doctors just don't know that it's an available solution, and they don't even offer it. So for me, a lot of dermatologists refer to in Israel the patient as a last resort after they failed all other drugs. I'm sharing with you from my colleague that is here with us today, Dr. Pham Tang, dermatologist, that is going to be the next speaker, about his results with monotherapy with skin in rosacea. So I think that Asia in general has a lot to earn from using IPL approach. So in summary, I've just shown you that there is a supported peer review literature with PubMed index clinical studies. We have a mechanism specific target in both acne and rosacea. It is safe, it is non-invasive, it's patient friendly. There are no consumables, no blood monitoring, no downtime. They can do whatever they want after treatment. They don't need to take oral drugs. There will be no antibiotic resistance. There is no lifestyle restriction. There is no reliance on patient compliance to take the pills or to apply the topical regimes. It's fast and effective. It has rapid onset of clinical improvement. We can treat large area in just minutes, and you can do simultaneously treatment of face, chest, and back with just one device. And this is also very important, and we don't talk enough about it. There is high return of investment for the aesthetic clinics with that, compared to other expensive devices that the chance that you will return of investment is very low, and it's very hard to sell them. So thank you very much for this, for your patience, and if you have any questions, you are free to ask.
Thank you, Dr. Pam, for your very
Thank you.
informative lecture, and I think